10 cases of polio have been confirmed in war-torn Syria. Most of the victims are younger than 2 years old. This marks the first outbreak of the disease in Syria since 1999. Now a public vaccination campaign is underway during this health emergency. That's because the 10 cases could be a tipping point, with hundreds more being infected with the disease. Earlier, I spoke to UNICEF's Sarah Crowe, and I asked her about the situation on the ground in Syria.
Well, that's right. This polio outbreak now in Syria, confirming 10 cases out of 22, is not only a public health emergency for Syria and a desperate situation for the country that is at war and in conflict, but also for the entire region and even as far as Eastern Europe, as Turkey, Romania, Ukraine, Bosnia. So UNICEF, World Health Organization, and our partners, we are now launching various country operations to really boost our vaccination campaigns across all of these countries at the same time. Right now, today in Jordan, in the Zatari camp, which houses up to 150-odd thousand refugees from Syria, we immunized tens of thousands of children, both today and yesterday, and this will continue. So what we have to do is look at not only the polio outbreak, but the general condition of children, which is, of course, extremely dire. Polio thrives in conditions like this, which are unhygienic, overcrowded, and areas which are simply inaccessible because of the conflict.
Sarah, you know, here in the West, polio, when you mention polio, it seems like the ancient past. It wasn't all that long ago, but a lot of people have forgotten about the spread of the disease, how quickly it can take off, what are some steps that can be taken. Can you talk about that?
Well, polio is endemic only in 3 countries in the world today, and that is Afghanistan, Pakistan, and Nigeria. We've seen major success in those 3 countries, down to all-time low number of cases in those 3 countries. We have seen outbreaks of polio in the Horn of Africa, and that is, of course, worrying. But polio anywhere is a risk to children everywhere.
How quickly can something like this spiral out of control? You were talking about how it's not just confined to Syria, it can be a regional, global issue. How quickly can something like this really kind of spin out of control?
Extremely quickly. What we do know is that these 10 cases are only probably a tip of the iceberg. Most of the time, for each polio case, it represents, for each polio case that is confirmed that shows paralysis in a child, there are up to 200 children who are infected. So this gives you a measure of the scale of this crisis. And of course, when a child is malnourished or undertreated for all the other cases, the other childhood diseases, it makes that child even more vulnerable. So it can spread extremely quickly throughout the region, and we do not yet know the genetic origin of this particular type of virus, and it could easily have come from afar. We don't yet know.
Still far more questions than answers. Sarah Crowe, thank you so much for your time.
Thank you.